My name is Dr. Antonia Arnaert and I am the President and CEO of Debson Medical Tourism. We are a medical health tourism facilitator company based in Montreal. We have office as well in US. And I'm here, I was invited by the Medical Tourism Association to speak about telehealth, telemedicine, and the role of telehealth and e-health in medical tourism. So I'm very excited. It's my second time here in LA. I was here as well last year. This afternoon, yes, I will speak this afternoon from 2 o'clock. It's all about the role of telehealth, telemedicine in medical tourism. I'm as well a professor at McGill University, and my whole research since a couple of years already is based on the use of information communication technology to support people on a distance. So we use all different kind of devices, Blackberries, iPhones, tablet PCs, people their own PC, so we can follow them, we can give better preoperative and postoperative care. So, for example, somebody who want to go for surgery, but at the same time who is uncontrolled diabetes, well, what we do first is we help to control his blood sugar before he leaves, and then he is better prepared to go for surgery to Costa Rica or whatever, and then when he come back, we follow him again. The same for people who has bariatric surgery, the same for people who go abroad for cardiac surgery. Those people really need good monitoring, preoperative, but as well post-surgery. So that's what we do with all different kind of devices. At the same time, what we try to do as well is before patients leave, for the country of destination, we do a video conferencing session with the physician. So it is a consultation meeting with the patient, the family caregiver, with our client manager as well. So just to have everybody on the same, how would I say, so that everybody knows what needs to be done, that everybody is at peace and can move on, and that everything can go smoothly. Oh yeah. So we started already, I'm doing already many years in Canada, in Montreal. I'm originally from Belgium and everything started there so many years ago. As I said, I was part of the European Commission in different projects that I did together with different European countries. Then 8 years ago I came to Canada. I moved to Canada. We developed it there in Montreal. We did a lot of research already for people in remote areas, because those people have in fact the same problems. They cannot come easily, to a big hospital in Montreal. So we do a lot of telemedicine already, telesurgery. For example, I'm doing as well a project now with people who has robotic surgery. Robotic surgery, they stay only 1 day in the hospital, but they have a lot of consequences. There are a lot of risk when they go home. So all those problems can be solved using different monitoring devices. It is safe, The only thing what I would like to say is that it is not just giving a BlackBerry to somebody. It's not just giving a computer to somebody. You need to train the nurses, first of all. You need to train, in fact, all the healthcare providers, but mainly the nurses who will do the monitoring of the patients. Because, it's kind of communicating on a different way. Now, it's when you use a video conference system, I'm using a lot of my hands, but you don't use that normally because the people will just see hands. So it's really a different way of communicating, between the healthcare provider and the patient. And it's really training different skills. Those nurses who provide telehealth, telemedicine, they need to have very good knowledge about the disease, but they need to have as well computer skills, communication skills, because they cannot touch the patient. They need to do everything on a verbal, and non-verbal way. So it's extremely important. What is a challenge as well, I need to say, is the access to the internet. Not everybody has access to the internet, definitely not in rural areas or, remote areas. That is sometimes a challenge. So we use different kind of satellite systems as well in all those regions and countries. Well, it is, as I said, I do that already many years now. But it is still, when I came to Montreal 8 years ago, I needed to convince people that it is a good system, because they thought, and nurses, they want to touch, which is good, which is good. But it's a different way of education. Like now at the school, we will try as well to educate the nurses in using all different kind of devices. So it is not a new concept, but it is changing in attitude. It's changing in the way we deliver care to people on a distance. What I believe very strongly is that the in-person care, the touch can never be, we can never delete that. It is extremely important. But what I see is that telehealth and in-person care can go hands in hand and needs to go hands in hand. It is kind of complementary. That is extremely important. Like, for example, when a patient needs home care, for example. Well, a nurse can go once, you know, in person, but then all the other sessions, they can do it remotely. Yeah? So it's really developing a trust relationship and then do a better follow-up care and continuity of care. So I was here last year and was very, very excited. It was my first, together with Dr. Zuman and Debbie, the Vice President in Debson Medical Tourism. We were here. We had a booth last year as well. So I like to come, you know, and I need to say I'm very thankful to the Medical Tourism Association. We were involved in some femme tours as well. So it's always nice to meet people, to networking, to make connections and to explore new opportunities. So I'm really, really thankful to the Medical Tourism Association. And I need to say as well, last year we were certified by the Medical Tourism Association last year in March. So this is a big thing as well for Debson Medical Tourism. I cannot say I like that more than the other. I think it's a great opportunity to meet the people, you know, that I met already in the FAM tour, that I met last year, that I speak over the phone, and then suddenly, you know, you meet them here in person, which is great. People from Turkey, from Bulgaria, and etc. It's a great opportunity to meet new people and to establish contacts. And it's as well a great opportunity to share, you know, our services that we provide, but at the same time to hear where medical tourism is worldwide. You know, that's important to know from Korea, you know, the new people here in the Arabic countries and etc. So that's a great opportunity to meet new people. I was amazing yesterday in the party that you see so many people from all different countries. Yeah, so we were all together, Belgium, you know, Turkey, all different. So this is a great opportunity. Oh, I think it's extremely important. I think they bring, they're kind of the leaders, yeah, in promoting medical tourism, to bring the people together, to network the people. And we as facilitator, we will implement it, yeah. Like, for example, the new book that Renee wrote regarding, the international departments. I think it's extremely important to make this sector strong in the future and to kind of define the guidelines, how and where we need to go. I think they do a great job.